So the questions are starting from question 27. We have reviewed some of these questions, but we're going to see them again. Actually, 26th. Based on the CDC, what is the maximum amount of community fluoride? Answer 1.2 parts per millimeter. That is the maximum amount of community fluoride, 1.2. What is the recommended amount? Is 0.7. Next question. What is most likely to cause pulpal response during tooth preparation? Answer, heat. Question. When you're doing an implant, what do you use? Answer, high torque. Question. Some new mouthwash that reduced the gingival index, but then the patient didn't have an increase in their oral care. That's a bias study. Wharton tumor is mostly seen where? Submandibular gland. Wharton tumor. And another question about that is that where Wharton tumor comes is Wharton tumor. A case you see a 50-year-old patient on the left side for more than 2 years had a right hand surgery 2 years ago. Mass is clear on the left side. Mass is not painful moving. Okay, so Warthin's tumor. Warthin's tumor, also known as papillary cystadenoma lymphomatosum, is a benign cystic lesion of the salivary glands containing abundant lymphocytes and germinal cells. It's not Wharton's, so it's Warthin's. It is named, so it's parotid gland. Parotid gland. Parotid gland. Wharton's tumor is mostly seen in parotid gland. Next, story about you gave epinephrine and the effects. The effects of epinephrine was heightened when taken with phenothiazine because of adrenergic receptor. Story about you gave epinephrine. What are the effects? The effects of epinephrine was heightened when taken with phenothiazine because it's adrenergic receptor. Next, which has the greatest margin of safety for the patient with renal disease? Acetaminophen. Acetaminophen. Again, which has the greatest margin of safety for a patient with renal disease? Acetaminophen. Next, when can you not do a gingivectomy? When it's apical to the crest. When it's apical to the crest. Apical to the crest. Next question. Drug that comes in troches, clotrimazole. Drug that comes in troches, clotrimazole. Drug that comes in troches, clotrimazole. Important topical drug, what is fungal, is ketoconazole and clotrimazole and nystatin. If it's IV, it's amphotericin. If it's fluconazole, it's IV and oral. So that's a good note to add. Okay. Okay, so I'm trying to add a note here that in the troches are clotrimazole. Um, here. Clotrimazole would be troches. Let's add here a note. Okay. This note says topical fungal will be ketoconazole, clotrimazole, and nystatin. IV will be amphotericin, and IV and oral will be fluconazole. So again, difficult tooths, actually, drug that comes in troches, clotrimazole. And we have a note here that says topical fungal drug, ketoconazole and clotrimazole and nystatin. Okay? Keto, clotri, and nystatin comes in troches, topical. Amphotericin is IV, and fluconazole IV and oral. Next, difficult tooth surface to floss, maxillary premolar. Next question. What's the order for delivering a cast crown? Internal, contact, margin, integrity. Again, what's the order for delivering a cast crown? Internal, contact, margin integrity, occlusion. Internal, contact, margin integrity, occlusion. Next. What's the common cause for porosity in porcelain? Answer, inadequate condensation. What's the common cause for porosity in porcelain? Inadequate condensation. Next, repeated fracture of metal framework. Why? Answer, poor framework design. Next, what does fluoride not do? Fluoride does not cause pit and fissures to coalesce. What does fluoride not do? It does not cause pit and fissures to coalesce. Patient swallows a crown. You took an x-ray. Where is the crown most likely located? In the right bronchus. Again, the patient swallowed the crown. You took an x-ray. Where is most likely located? In the right bronchus. Next, most common cause of amalgam failure. Answer, moisture contamination. When there is an allergy to a crown, it's most likely due to, answer, nickel. When there's an allergy to a crown, the most likely cause is allergy to nickel. Next, what can base alloys be used for? What can base alloys be used for? The answer, I believe, is single crown. We're gonna Google that. Base alloys. So, base alloys. So base alloys, base metal alloys have a lower density than type 4 or extra hard gold alloys. This low density is of base metal alloys makes the casting process difficult. Compared to gold alloys, base metal alloys have higher resistance to deflection in thin segments, higher modulus of elasticity, much higher melting point temperature, and low yield strength, lower specific gravity, and lower density. So nickel is is most commonly associated with allergies in crowns. In nickel increases ductility. The nickel in the composition of base metal alloys is responsible for the alloy's ductility. It is also measured as a percentage of elongation and determines how much margins can be closed via burnishing. So there is a classification of the alloys by the ADA. Type 1 is small inlays. Type 2, larger inlays and onlays. Type 3, onlays, crowns, and short span fused to porcelain. FPDs. And type 4 is thin veneer crowns, long span FPDs and RPDs. FPDs. And FPD is, oh, okay. Fixed partial dentures and removable partial dentures. So that's what it is. So again, the nickel type 3 classification of alloys is In type 3, only crowns and short span the short span, let me see, what did we say? Short span fixed partial denture. Fixed partial denture. And for type 4 alloys is veneer crowns, long span, fixed partial denture, and removable partial denture. So going back to the answer to the question, what can base alloys be used for? It can be used for single crowns. Which I'm not sure, because it can be used for single crowns according to the classification of the alloys. And bridges, like fixed partial dentures. Anyway, next question. A storyline about a guy who only had 4 anterior teeth remaining and was completely edentulous in the maxilla. How will the mandible look? The crowns will appear longer. Super erupted. Okay. Next, contraindication to uses of nitrous, psychosis. What's the effect if you give diazepam to the elderly? In older patients, the drug greatly increases the risk of falls, broken bones, and confusion. It can also cause dependence and withdrawal symptoms. What is not part of the 5 Code of Ethics? Competency. The 5 codes of ethics. 5 code ethics are loyalty, fairness, anyway. The one that is not part of the 5 codes of ethics is competency. Next, what's the hematologic malignancy that affects plasma cells? Multiple myeloma. Multiple myeloma. Multiple myeloma. So multiple myeloma, plasma cells are a type of in multiple myeloma, plasma cells become cancerous and multiply. This damages bones, immune system, kidneys, and red blood cell count. Multiple myeloma is hematologic malignancy that affects plasma cells. Next, what do you see in myocardial infarction but not in angina? Angina, thrombosis. What do you see in myocardial infarction but not in angina? Thrombosis. Why don't you see it in thrombosis? Because thrombosis is a formation. So angina can be caused by low levels of oxygen reaching your heart, and that's not necessarily because of thrombosis. So, what do you see in myocardial infarction but not in angina? Thrombosis. Next question. A patient who took oxycodone and developed hypotension and itching. Why? It's a side effect of the histamine. Because of histamine side effect. Histamine, itching, hypotension. Histamine, itching, hypotension side effect of oxycodone. Oxycodone, itching, hypotension, histamine. Next. Place denture in the mouth and they experience temporary salivation due to, answer, parasympathetics. Parasympathetics. Next question. Patient satisfaction with dentures. Answer, cultural definition of aesthetics. Cultural definition of aesthetics. Next, which drug wouldn't raise a concern for perio problems? So I believe the answer to that, which drug wouldn't raise a concern for perio problems, would be aspirin. As I have checked some studies, it seems like prednisone, methotrexate, and hydrochlorothiazide will have a effect on perio. Next, which isn't in the line of drugs for angina? Answer, beta blockers. Beta blockers are not in line for angina. Which isn't in the line of drugs for angina? Beta blockers. Next, what would be a concern for someone who on a vasodilator is on a vasodilator and also taking drugs for erectile dysfunction? Answer, hypotension. Vasodilator and erectile dysfunction. Hypotension. Next, how long after doing an aesthetic gingivectomy do you have to wait before you can do general restorative work? I think it's 3 to 5 weeks. 3 to 5 weeks. How long after doing aesthetic gingivectomy do you have to wait before you can do general restorative work? 3 to 5 weeks. A two-part question. The epithelium of a free autogenous gingival graft undergoes degeneration at the recipient site. Genetic info to the nature of the epithelium overlying the connective tissue is contained within the graft connective tissue. Both are true. Next, after you did periosurgery, how can you determine if the junctional epithelium grew or not clinically? After you did periosurgery, how can you determine if the junctional epithelium grew or not clinically? Next question. Herpangina is due to human enterovirus. Human enterovirus. Remember that it's also known as the hand, foot, and mouth disease that will cause the human enterovirus. Next, what active against herpes simplex virus, varicella zoster, and cytomegalovirus? Answer, valacyclovir. Active against herpes simplex, zoster virus, and cytomegalovirus. Acyclovir or valacyclovir? Valacyclovir. Next, what is mostly seen in the gingival crevicular fluid? IgG. Mostly seen in the gingival crevicular fluid, IgG. Next, older patient comes to your office. What is your primary concern? No mention that the patient has a hearing problem. An older patient comes to your office. What is your primary concern? To find out if they have a guardian. In the treatment planning book, the concern is if they more than likely have a caregiver. Okay, next. What is considered an endo-emergency? Answer, a necrotic pulp with symptomatic periapical. Symptomatic periapical. That is an endo-emergency. Necrotic pulp with symptomatic periapical. Next, what mouthwash do you give to a medically compromised child? Chlorhexidine. In the pedo book, it's mentioned as being used on autistic children and Down syndrome patients. What mouthwash do you give to a medically compromised child? Chlorhexidine. Next, which is the most radio-resistant cell? Nerve. First nerve, then muscle, then brain cells, then bone cells. What is the most radio-resistant cell? Nerve. And as it goes from more resistant to least resistant is nerve, muscle, brain, and then bone. Next, the theory of radiology that deals with white matter radiation. The question is, it's not remember how it was phrased, but the answer is photoelectric. So the photoelectric theory of radiology, the theory of radiology that deals with white matter radiation, photoelectric. Okay, let's see photoelectric radiation. So the photoelectric effect is the emission of electrons or other free carriers when light shines on a material. Okay. White matter, photoelectrons. The complete absence, the absence of teeth are anodontia. Complete absence of teeth, anodontia. Next, fancy term for an eye infection involvement, pemphigus. Fancy term for an eye infection involvement. Next, patient who is diabetic, which of the following would not cause a reason for insulin? Something along those lines. Again, patient who is diabetic, which of the following would not cause a reason for insulin use? Stress, trauma, or sedation? The answer is sedation. Sedation would not cause a reason for insulin use in a patient who is diabetic. Stress and trauma would. Next, when you are with a child patient smiling and giving them praise, is called social reinforcement. Social reinforcement. When you're with a child smiling and give them praise, social reinforcement. Next, what can you not see on a periapical radiograph? Mandibular foramen. Yes. You can see the maxillary sinus, you can see the mental foramen, but not the mandibular foramen. Mandibular foramen, let me see. Mandibular foramen is an opening on the internal surface of the ramus of the mandible for divisions of the maxillary, of the mandibular nerve and blood vessels to pass through. You will not be able to see the mandibular foramen in a PA. Next, what drug is considered safe to give in a patient with myasthenia gravis? Penicillin. Myasthenia gravis, penicillin. Next question. What kind of trauma causes necrosis? Inflammatory. What kind of trauma causes necrosis? Inflammatory. Next, what kind of trauma causes ankylosis? Replacement. So what kind of trauma causes necrosis? Inflammatory. What kind of trauma causes ankylosis? Replacement. Yes, because there is a replacement of the cells in the PDL by osteoblastic activity. So there's a replacement. So what kind of trauma causes ankylosis? Replacement. What kind of trauma causes necrosis? Inflammatory. What is true about neonatal teeth? What is true about neonatal teeth? Common in the mandibular incisor area. In the pedo book says that they are not required to be extracted, but the concern is that it can be aspirated. Next question. first pass effect. Answer, biotransformation in the liver. First pass effect. The first pass effect, also known as first pass metabolism or pre-systemic metabolism, is a phenomenon of the drug metabolism whereby the concentration of a drug is greatly reduced before it reaches the systemic circulation. It is a fraction of drug lost during the process absorption, which is generally related to the liver and gut wall. So, first pass effect, biotransformation in the liver. Next, which is similar or seen on Behçet ulcer? Behçet ulcer. Behçet's disease, also known as the Silk Road disease. There's a blood vessel inflammation throughout the body. In the mouth, it causes painful mouth sores that look similar to canker sores and are the most common sign of Behçet's disease. They begin as raised, round lesions in the mouth that quickly turn into painful ulcers. The sores usually heal in 1 to 3 weeks, though they do recur. So, which is similar or seen in Behçet's ulcer? What is lithium used for? Depression phase of mania. And you can see that according to this in the Denton book. So let's see lithium in the Dental Secrets. Lithium. Let's see. So yes, in the Boardbusters book, lithium is a current drug of choice to treat the manic phase of bipolar disorder. Bipolar disorder is characterized by cyclical changes in affective state between the manic and depressive phases of behavior. Bipolar patients cycle between the two affected states. Lithium is used mainly to suppress recurrences of the manic phase of the bipolar disorder. It is not useful to treat acute manic disorders. Lithium can prevent the occurrence of depressive and manic disorder in some but not all patients. Antidepressants are often administered with lithium to manage the depressive phase of bipolar disorder if lithium alone is insufficient. So, what is lithium used for? Depression phase of mania in bipolar disorder. Next, perio maintenance. Perio maintenance depends on each patient. Next, test to use for crown. Thermal test. Thermal test is the best test to use for crown. Thermal test, and we're gonna see it here. Which of the following? Okay, thermal test. So a root canal therapy, a tooth with a root canal therapy that responds to thermal test indicates that there is an inadequate debridement, since a pulpless tooth should not respond to any stimuli. Thus, all nerve must be removed before the canal is obturated. Thermal sensitivity The earliest and most common symptom of pulpal edema or inflamed pulp is thermal sensitivity to hot or cold stimuli. Usually involves increased and persistent pain to cold. The best method to elicit the most accurate thermal response is to individually isolate the suspected teeth with rubber dam, then bathe each tooth in hot or cold water. All other methods may stimulate the tooth in only one section of the surface, thus are less accurate. They may Thermal tests may yield a false negative in immature, recently traumatized, or due to premedication with an analgesic. As caries enter the dentin, it spreads laterally at the dental-enamel junction due to the increased organic content and involvement of many dentinal tubules. Stolnus fibers react, cause fatty degradation, and later decalcification. As caries progresses, dentin destruction is followed by bacterial invasion of the tubules and complete dentin destruction. Once odontoblasts are involved, pulpal changes occur. The only reliable clinical evidence that secondary dentin has formed is decreased tooth sensitivity, seen a few weeks after placing filling. When dentinal tubules become completely calcified, dentin is insensitive. So, anyway, test to use for crown thermal test. Next, oral lesion that is easy to treat. Hematoma. The easiest to treat, it's a hematoma in the mouth. Oral lesion that is easier to treat, hematoma. Hematoma on the cheek. Next, macroglossia not seen in hyperparathyroid. There will be macroglossia in acromegaly and amyloid. In amyloidosis. Yeah. Microglossia due to amyloid depositions can cause cosmetic problems and functional disability. Acromegaly and macroglossia is known to go together also. So hyperthyroid, not hyperparathyroid. Hyperthyroidism and macroglossia don't go together. Oh, hyper, not hypo. So, see hypers and hypos, okay? Macroglossia not seen in hyperthyroidism. Next question. Why do you ask for a medical consult? To gain information. Why do you ask for a medical consult? To gain information. Next. What is not included in a consent? The cost. And a consent does not include the cost. Pericoronitis. Pericoronitis, what is the treatment? Curettage. The question doesn't mention anything about having fever or swelling, so curettage. Next. The lingual nerve Next question. The lingual nerve is in a certain position. If you move the beam inferiorly with the cone head facing superiorly, where is the nerve? Again, the lingual nerve is in a certain position. If you move the beam inferiorly, the cone head facing superiorly, where is the nerve? Apical. Remember the Slub rule. The Slub rule says the buccal. The Slub rule is the occlusal film below same lingual, opposite buccal. So if Slub, just remember same lingual, opposite buccal. If it moves in the opposite direction, then you move the cone, then it's buccal. If it moves in the same direction, it's lingual. Next question. Where are caries found in a composite restoration? Where are caries found in a composite restoration? So if it doesn't say if it's referring to recurrent caries, it will be occlusal. Next. What is not true about periapical cementoosseous dysplasia? Periapical cementoosseous dysplasia are mostly seen in women, in black women, and they're not in the anterior maxilla. Well, actually, they are. So, periapical cementoosseous dysplasia yes, it is most common in African American females. There are 3 types. It occurs mostly in mandibular anterior teeth. And if it's focal, it will appear more in the mandibular posterior teeth. So it could be what is not true about periapical cementoosseous dysplasia. It could be that it only happens in the anterior maxilla because it can also occur on the posterior maxilla. Next question, ameloblastoma, locally invasive. Ameloblastoma, it's benign, and it's a cancerous tumor of odontogenic epithelium. Appears more in the lower jaw, and ameloblastoma is often associated with unerupted teeth. It is invasive. Let me see, is it okay. I'm reading ameloblastoma. Okay. Well, now the first another question. Maslow's theory of the patient needs. The theory of the needs, from the more important to the less important. Psychological needs, basic, to the most important to the less important. Basic needs, food, shelter, then, okay, the physiological needs, food and shelter. Next, safety, job, which is job and security, etc. Then social, which is to be part of a team, feeling wanted. Then the self-esteem, which is the level of status. Then the self-actualization, which is professional goals. So physiological, safety, social, self-esteem, and self-actualization last. You had to look at the drugs the patient is taking, the oral bisphosphonate, risperidone. The cause of perio is due to the medication. Perio is due to medication. Next, there's a new hypothetical test that is used to diagnose caries. What does this new test need to have? A clinical trial. Next, patient taking cimetidine. What does this drug cause? Xerostomia.